Welcome. You are listening to IJD in Focus, the monthly podcast series of the International Journal of Dermatology, featuring the latest editor's highlights and a summary of our open access publications available to everyone.
The February issue of the IJD reflects the growing complexity of managing chronic inflammatory skin diseases in the era of targeted therapies. Covering atopic dermatitis, psoriasis, and hidradenitis suppurativa, the featured papers address clinically relevant questions related to treatment safety, disease-associated comorbidities, and long-term therapeutic outcomes. Key topics include vaccination strategies in patients receiving Janus kinase inhibitors, ocular complications associated with atopic dermatitis, malignancy considerations in biologic-treated psoriasis, long-term efficacy and safety of selective tyrosine kinase 2, TYK2, inhibition, and dose optimization of biologic therapy in hidradenitis suppurativa. Together, these contributions highlight a shift toward personalized, risk-aware management strategies that balance sustained efficacy with long-term safety in chronic inflammatory dermatoses.
Setting the stage for the evolving therapeutic landscapes, a viewpoint by Perry et al. Examines how drug pricing policy may shape the future of dermatologic care. The article discusses an executive order from April 15, 2025, signed by President Trump directing the U.S. Department of Health and Human Services to work with Congress to address what has been termed the pill penalty under the Inflation Reduction Act. This allows Medicare to negotiate prices for small molecule drugs after 9 years, but biologics after 13. A disparity critics say distorts pharmaceutical investment. The authors outline competing perspectives. While proponents of reform suggest that extending exclusivity for small molecule drugs could encourage innovation, critics caution that delaying price negotiations may increase costs for patients and healthcare systems and undermine the law's cost containment goals. Importantly, the authors emphasize that meaningful changes would require congressional action, underscoring the policy complexities surrounding access, equity, and affordability in dermatology.
From health policy to day-to-day clinical decision-making, a comprehensive review by Ara Martin et al. Focuses on vaccination strategies for patients with atopic dermatitis receiving Janus kinase inhibitors. Atopic dermatitis therapy has undergone a revolutionary change with the introduction of Janus kinase inhibitors. Despite their general safety profile, these immunomodulatory drugs require special precautions with respect to infection risk and vaccine administration. This article aims to provide dermatologists and other healthcare practitioners with comprehensive practical vaccination recommendations for adults and adolescent patients with atopic dermatitis who are receiving or are about to receive treatment with JAK inhibitors. While inactivated vaccines are safe and recommended during JAK treatment, live-attenuated vaccines are contraindicated unless treatment is temporarily discontinued according to clinical guidelines. It is crucial to follow vaccination guidelines established by official agencies and tailor them to individual patient needs. Careful consideration and follow-up are essential to ensure patient safety and optimal therapeutic outcomes.
Broadening the discussion from immunomodulation to regenerative medicine, a narrative review by Da Costa Pereira Sestari et al. Explores the therapeutic potential of mesenchymal stromal cell-derived secretomes and exosomes in dermatology. Mesenchymal stromal cells, or MSCs, exert their effects primarily through paracrine signaling via soluble factors and extracellular vesicles, EVs, especially exosomes. These acellular components offer regenerative and immunomodulatory benefits with fewer safety and logistical constraints than cell-based therapies. This study aims to review the composition, mechanisms of action, and dermatologic applications of MSC-derived secretomes and exosomes, including engineered and primed variants, and to discuss translational barriers and safety considerations. A structured literature search was conducted using PubMed and Embase, studies on molecular content, preclinical and clinical data, engineered EVS, oncologic safety, and regulatory aspects of MSC-derived products in dermatology were included. The MSC secretome includes cytokines, chemokines, growth factors, lipids, and regulatory RNIs that modulate inflammation, promote repair, and support skin homeostasis. Exosomes, particularly those from primed or engineered MSCs, play a key role via targeted microRNA delivery. Preclinical data support efficacy in atopic dermatitis, psoriasis, alopecia areata, vitiligo, chronic ulcers, and photoaging. Pilot clinical trials show promising safety and feasibility for topical or intradermal use. However, product heterogeneity, unclear dosing, long-term oncologic safety, and regulatory challenges persist. MSC-derived secretome and exosomes, especially those from primed or engineered MSCs, offer a promising cellular platform for dermatologic therapy. Clinical translation requires standardization, mechanistic validation, and rigorous safety evaluation through well-designed trials.
Translating targeted therapy into long-term disease control, a research article by Alavi et al. Examines secukinumab dosing strategies in hidradenitis suppurativa. In this pooled analysis from the Sunshine and Sunrise Phase 3 trials, the authors evaluated pharmacokinetics and safety over 1 year of treatment. They found that drug exposure varied according to body weight, disease severity, and baseline inflammation, and that more frequent dosing may benefit selected patients. Importantly, secukinumab was associated with sustained reductions in systemic inflammation and maintained a safety profile consistent with other approved indications, supporting its role as a long-term treatment option for moderate to severe hidradenitis suppurativa.
Ocular safety in biologic-treated atopic dermatitis is the focus of a real-world observational study by Potestio et al. Conjunctivitis is among the most frequent adverse events that emerge in clinical trials for all biologic drugs approved for atopic dermatitis. However, real-world comparative data on the incidence, risk factors, and management of conjunctivitis remain limited. We aim to compare the incidence, clinical features, and management of conjunctivitis in patients with moderate to severe AD treated with dupilumab or tralokinumab in a real-life setting. A multi-center, retrospective, observational study including adult patients with moderate to severe AD treated with dupilumab or tralokinumab for at least 16 weeks was carried out. Demographic, clinical, and therapeutic data were collected from 35 dermatological referral centers across Italy. Conjunctivitis incidence, severity, time to onset, and ophthalmologic management were analyzed and compared between treatment groups. A total of 6,668 patients were included, 5,899 on dupilumab and 769 on tralokinumab. Conjunctivitis occurred in 10.76% of dupilumab treated and 12.61% of tralokinumab treated patients, with no statistically significant difference in overall incidence. However, time to onset was significantly shorter with tralokinumab than with dupilumab. Ophthalmologic management strategies were similar between groups, mainly involving lubricants and corticosteroid-based eye drops. Dupilumab-treated patients more frequently discontinued or switched treatment due to conjunctivitis than tralokinumab patients. Conjunctivitis represents a relatively frequent AE in patients with AD receiving dupilumab or tralokinumab. However, earlier onset of conjunctivitis with tralokinumab and higher discontinuation rates with dupilumab suggest differing tolerability profiles. Early recognition of ocular symptoms is essential, and dermatologists should promptly initiate supportive eye care and refer to ophthalmologists when appropriate to avoid unnecessary treatment interruptions.
Shifting from inflammatory disease to skin cancer risk, a short communication by Meisenheimer et al. Examines anatomic patterns of squamous cell carcinoma. Cutaneous squamous cell carcinoma is a common UV-driven cancer whose anatomic and histologic risk patterns are incompletely understood, prompting this large retrospective study of SCC in situ and invasive SCC across body sites in a veteran population. Analyzing nearly 14,000 tumors, the study found that high-risk, moderately to poorly differentiated SCCs were disproportionately concentrated on the face and scalp compared with other UV-exposed and protected areas, suggesting that anatomic factors beyond UV exposure influence tumor aggressiveness. These findings help explain the higher metastatic risk of head and neck SCCS, although generalizability is limited by the predominantly white male cohort and by reliance on tumor differentiation alone to define risk.
Returning to long-term management in atopic dermatitis, a multi-center real-world case series by Bangert et al. Reports on extended use of tralokinumab. This multi-center Austrian case series evaluated the long-term real-world effectiveness and safety of tralokinumab in 13 adults with moderate to severe atopic dermatitis treated for a median of 29 months, with most patients receiving therapy for over 1 year and some up to 3 years. Tralokinumab led to sustained and marked improvements in disease severity and pruritus, with median EASI, IgA, and PP-NRS scores all substantially reduced, and the majority of patients achieving clear or almost clear skin. Treatment was generally well tolerated, with mostly mild and transient adverse events, supporting tralokinumab as an effective long-term option for atopic dermatitis, despite limitations related to small sample size and study design.
Medication-associated skin disease is addressed in a large population-based study by Mirawat et al. This large retrospective cohort study assessed the risk of immune-mediated skin diseases in patients with type 2 diabetes, treated with DPP-4 inhibitors compared with SGLT2 inhibitors or thiazolidinediones, leveraging data from over 700,000 matched patients in the TriNetX network. DPP-4 inhibitor use was associated with a significantly increased risk of bullous pemphigoid and a modest but significant increase in atopic dermatitis, while no elevated risk was observed for other immune-mediated skin diseases. Risk varied by agent and over time, with sitagliptin and linagliptin showing the strongest associations, underscoring the need for long-term dermatologic vigilance and individualized drug selection in susceptible patients.
A novel therapeutic approach is presented in a case-based short communication by Briatico et al., focusing on basal cell nevus syndrome. Basal cell nevus syndrome is a rare inherited disorder driven by aberrant sonic hedgehog signaling that leads to early-onset multiple basal cell carcinomas, often making repeated surgery cosmetically and psychologically burdensome. This case report describes a young woman with BCNS who declined systemic hedgehog inhibitors and was treated with pulsed dye laser for superficial BCCs and ND:YA-G laser for nodular lesions, achieving complete lesion clearance over 12 months with good cosmetic outcomes and no scarring. The findings highlight laser therapy as a promising non-invasive alternative for selected BCNS patients, particularly those wishing to avoid surgery or systemic treatment, though larger studies are needed to confirm efficacy and durability.
The episode concludes with a striking clinical correspondence by Nemeth et al., describing a rare but severe complication of long-term bisphosphonate therapy. This case describes a 76-year-old woman on long-term oral alendronate who presented with bilateral, tender submandibular nodules unresponsive to antibiotics, ultimately found on CT imaging to have extensive bilateral mandibular osteonecrosis with fistulizing disease. The findings illustrate a rare and severe presentation of bisphosphonate-related osteonecrosis of the jaw, or BRONJ, in which impaired mucosal healing and bacterial invasion lead to cortical erosion and cutaneous fistula formation. The report emphasizes the need for early imaging and heightened clinical suspicion for BRONJ in patients with persistent or atypical mandibular lesions, even when bisphosphonates are used at low doses for osteoporosis.
We have reached the end of our February episode of IJD in Focus. Thank you for listening. Until next time.